Imagine waking up one ordinary morning and forgetting the name of someone you have loved for decades. Picture driving a route you have traveled thousands of times, only to suddenly wonder where you are. Most people would immediately blame aging, believing it is simply part of growing older. But what if I told you that, for countless seniors, the real culprit is not age at all? What if the memory slipping away day after day is being quietly stolen by medications they trust completely? Every minute, another family begins facing the frightening reality of dementia, and while many cases are linked to disease, some begin with something far more ordinary, a pill bottle sitting in a bathroom cabinet. The most unsettling part is that these medications are often prescribed by trusted doctors or purchased over the counter without a second thought. Few people ever imagine that something meant to improve their health could slowly damage the very organ that makes them who they are. That is exactly why today's conversation matters. It is not about creating fear or telling anyone to stop their medication. It is about understanding hidden risks, asking better questions, and protecting your brain before small changes become permanent. Stay with me until the end, because the medication ranked near the top of this list is taken by millions of older adults every single day, and most have never been warned about what it may be doing to their memory. One simple conversation with your doctor after watching this could make a life-changing difference. My name is Dr. John Meyers, and after more than 15 years caring for older adults, I have witnessed the same heartbreaking pattern again and again. A person who spent an entire lifetime sharp, independent, and confident slowly begins forgetting appointments, misplacing everyday objects, or struggling to follow conversations that once came naturally. Families usually assume this is simply what happens with age, while doctors often begin looking for Alzheimer's disease or another form of dementia. Yet, in many of these situations, the true cause is hiding in plain sight. It is not an illness growing inside the brain. It is a medication quietly interfering with the brain's ability to function the way it should. Recent medical research continues pointing toward a surprising reality. Several common medications, many of which people take every single day, have been linked to faster memory decline, reduced learning ability, and a significantly greater risk of dementia. Today, we are counting down the 9 medications most strongly connected to this hidden danger, beginning with those that are frequently overlooked and ending with the one I consider the greatest threat of all. Before we continue, I would love to know something about you. Tell me your age in the comments and share which medications you take every day. I read those comments carefully because they help shape the information I bring to future videos. Let's begin with number 9, and do not underestimate it simply because it appears at the bottom of today's list. In fact, this medication is sitting inside millions of homes right now, and many people reach for it without thinking twice. The drug is diphenhydramine, better known by its familiar store name Benadryl. Most people know it as the little pink pill they take for allergies, a cold, or when they cannot sleep. It is inexpensive, available without a prescription, and because anyone can buy it, many assume it must be harmless. Unfortunately, the brain tells a very different story. Benadryl belongs to a group of medications called anticholinergic drugs. While the name sounds complicated, the idea is surprisingly simple. These drugs block a chemical messenger called acetylcholine, one of the brain's most important tools for forming new memories, staying mentally alert, and processing information throughout the day. As we grow older, our brains naturally produce less acetylcholine, making every remaining supply increasingly valuable. That means a medication that causes only mild effects in a younger adult can have a much stronger impact on someone in their 70s or 80s. One of the first areas affected is the hippocampus, a small structure deep inside the brain responsible for creating and storing new memories. Think of it as your brain's filing system. Every conversation you have, every face you recognize, and every new experience passes through this area before becoming part of your long-term memory. When acetylcholine is repeatedly blocked, that process becomes less efficient. Memories become harder to create, concentration begins to fade, and simple mental tasks suddenly require much more effort than before. Over the years, I have cared for patients who faithfully took a nighttime antihistamine every evening for years, without ever realizing it could be contributing to their growing mental fog. They blamed aging when they forgot names. They blamed stress when they lost focus. They never suspected the small pink tablet beside their bed. Yet scientific evidence continues supporting what many physicians have quietly observed in practice. A 2023 study published in the Journal of Geriatric Cognitive Health found that older adults who regularly used anticholinergic medications had a 54% greater risk of developing dementia compared with those who avoided them. That is not a small increase. It represents a serious warning about a medication many families treat as casually as cough drops. The good news is that there are safer alternatives. If you regularly take Benadryl for allergies, speak with your physician about newer antihistamines, such as loratadine, commonly sold as Claritin. Unlike diphenhydramine, these medications are far less likely to enter the brain and interfere with memory. Also, pay close attention to products labeled PM, nighttime, or sleep aid, because many of them contain the exact same ingredient under a different brand name. Most importantly, never stop a medication without medical guidance. Instead, use this information to begin an informed conversation with your healthcare provider. Understanding what is inside your medicine cabinet may be one of the most important steps you ever take to protect your memory. And as surprising as number 9 may be, the next medication on our countdown hides in the stomach, where it quietly begins affecting the brain in ways very few people ever expect. Many people believe that if a medication eases their symptoms and their doctor keeps renewing the prescription, it must be completely safe for long-term use. That assumption is understandable, but it can also become dangerous when no one pauses to ask what that medicine may be doing, beyond the problem it was meant to treat. The next drug on our list is a perfect example because it brings relief to millions of people every day while quietly affecting the brain in ways that often go unnoticed for years. Number 8 is the group of medications known as proton pump inhibitors, or PPIs. You probably recognize them by names such as omeprazole, sold as Prilosec, or esomeprazole, better known as Nexium. These medicines are widely prescribed for acid reflux, chronic heartburn, stomach ulcers, and that uncomfortable burning sensation that often follows a heavy meal. For many people, they feel almost miraculous because the symptoms disappear within days. The problem is that once the relief begins, many continue taking them for years without ever asking whether they are still necessary. What most people never hear is that stomach acid has an important purpose beyond digestion. It acts like a key that unlocks essential nutrients from the food we eat, allowing the body to absorb them properly. Among the most important of these nutrients is vitamin B12, which plays a critical role in keeping the brain and nervous system healthy. Without enough B12, nerve cells struggle to communicate efficiently, and memory, concentration, and mental clarity can begin to decline little by little. The longer stomach acid is suppressed, the harder it becomes for the body to absorb not only vitamin B12, but also magnesium and calcium. These minerals are essential for healthy brain activity because they help nerve cells send electrical signals accurately. When their levels gradually fall, neurons become less efficient, communication between brain cells weakens, and symptoms like forgetfulness, confusion, and slowed thinking may begin to appear. In many older adults, these changes resemble the earliest stages of Alzheimer's disease, even though the underlying cause may simply be years of nutrient deficiency triggered by a medication they trusted. Research has raised serious questions about this connection. A major study published in 2016 in JAMA Neurology followed more than 73,000 adults over the age of 75. The investigators found that regular users of proton pump inhibitors had approximately a 44% greater risk of developing dementia compared with those who did not take these medications regularly. While studies continue to examine the exact relationship, the findings are concerning enough that many specialists now encourage physicians to review long-term PPI use carefully, rather than allowing these prescriptions to continue indefinitely without reassessment. Scientists have also uncovered another possible explanation. Some research suggests that prolonged use of proton pump inhibitors may contribute to increased levels of amyloid beta, the sticky protein that accumulates inside the brains of many people diagnosed with Alzheimer's disease. Although this does not prove that the medication directly causes dementia, it raises another important reason to evaluate whether long-term treatment is truly necessary. When several warning signs begin pointing in the same direction, they deserve careful attention rather than being dismissed. If you take one of these medications every day, the answer is not to throw it away tonight. Instead, schedule a conversation with your healthcare provider and ask whether the current dose is still appropriate. Many people discover that after improving their diet, avoiding late-night meals, reducing excess weight, or limiting foods that trigger reflux, they they can gradually reduce their dependence on these medicines. Others may benefit from switching to H2 blockers, such as famotidine, commonly sold as Pepcid, which generally have a much lower impact on brain function. Some individuals also find relief through natural approaches like deglycyrrhizated licorice, a compound that helps soothe the stomach lining without carrying the same concerns for cognitive health. The goal is never to suffer through painful heartburn, but to use the lowest effective treatment for the shortest reasonable period whenever possible. Now we arrive at number 7, a medication prescribed for a condition that many older adults hesitate to discuss because they find it embarrassing. An overactive bladder can interrupt sleep, limit travel, create anxiety about leaving home, and affect nearly every part of daily life. That is why medications like oxybutynin, commonly sold as Ditropan, have become so widely prescribed. For many people, they provide real relief from the constant urgency and frequent trips to the bathroom. Unfortunately, that relief may come with a hidden cost that is rarely explained before the prescription is written. Oxybutynin works by blocking the same chemical messenger we discussed earlier, acetylcholine. Remember, this is the neurotransmitter responsible for helping the brain create memories, maintain focus, and process new information. Unlike some medications that have only limited effects on the brain, oxybutynin crosses into brain tissue very easily. Once there, it interferes directly with the systems responsible for learning and memory, making it one of the strongest cognitive concerns for older adults on today's list. Medical evidence has become increasingly difficult to ignore. A large study published in the British Medical Journal in 2019 examined adults over the age of 65 who had taken strong anticholinergic medications like oxybutynin for longer than 1 year. Researchers found that these individuals had nearly a 49% higher risk of developing dementia compared with those who had not used these drugs. Perhaps even more troubling is that many patients reported never being informed about this possibility. They were told the medication would improve bladder control, but few were warned that it might also gradually affect memory and thinking over time. Families often notice the changes before the patient does. Missed appointments become more common. Keys disappear several times a week. Conversations lose their thread halfway through. Names that once came instantly suddenly take several minutes to remember. Everyone assumes these changes are simply part of growing older, when in reality the prescription bottle may be playing a much larger role than anyone realizes. The encouraging news is that safer alternatives now exist. Medications such as mirabegron, sold as Myrbetriq, work through a completely different mechanism and do not block acetylcholine. For many older adults, they provide similar bladder control while posing far less risk to memory and cognitive function. If this medication is part of your daily routine, it may be worth asking your physician whether another option could better protect both your bladder and your brain. And as concerning as these medications may be, the next one on our countdown surprises even more people because it is prescribed to millions specifically to protect the heart, yet for some individuals, it may also be quietly affecting the mind. Number 6 may be the biggest surprise so far because these medications have helped save countless lives. They are prescribed every day to reduce cholesterol, lower the risk of heart attacks, and prevent strokes. Drugs such as simvastatin, known by the brand name Zocor, and atorvastatin, sold as Lipitor, have become some of the most commonly prescribed medications in the world, especially for adults over 60. Let me be very clear before we go any further. This is not an argument against statins. For many people, they are absolutely the right choice. But every medication deserves an honest conversation about both its benefits and its possible risks. Most people think of cholesterol as something harmful that simply clogs arteries. The truth is much more complicated. Your brain is made up of nearly 60% fat, and cholesterol is one of the essential building blocks it uses to maintain healthy nerve cells. It helps produce myelin, the protective coating wrapped around nerves that allows signals to travel quickly and accurately. Without enough of this insulation, communication between brain cells becomes less efficient, and mental performance can begin to suffer. Certain statins can cross into brain tissue more easily than others. When cholesterol levels are lowered aggressively over long periods, some researchers believe the brain may not always have the materials it needs to function at its best. A study published in Frontiers in Aging Neuroscience in 2023 found that adults over 70 who had taken statins for more than 3 years experienced a 26% higher rate of mild cognitive impairment. While this does not mean statins cause dementia, it does suggest that some individuals may become more vulnerable to memory problems, particularly at higher doses. Many patients describe the experience in remarkably similar ways. They suddenly struggle to remember familiar names, forget conversations that happened only moments earlier, or become confused while driving roads they have followed for decades. These episodes can be frightening because they seem to appear without warning. Fortunately, not every statin behaves the same way. Medications such as pravastatin and rosuvastatin enter the brain less readily and are generally considered friendlier to cognitive function. If you have noticed increasing brain fog since starting a statin, do not stop taking it on your own. Instead, speak with your physician about whether adjusting the dose or changing to a different statin might offer the same cardiovascular protection while reducing unwanted cognitive effects. Before we continue, let me pause for just a moment. If today's information has already helped you connect some important dots, take a second to support this video by pressing the like button. It helps this message reach more older adults and more families who may unknowingly be facing the very issues we are discussing. While you're there, tell me in the comments how many prescription medications you currently take each day. I genuinely read those responses because they reveal patterns that deserve more attention than they often receive. Now we move into the top 5, where the risks become even more significant. Number 5 belongs to a group of medications called benzodiazepines. You probably recognize names like lorazepam, sold as Ativan, diazepam, better known as Valium, and alprazolam, commonly called Xanax. These drugs are widely prescribed for anxiety, panic attacks, and insomnia because they work quickly. For someone overwhelmed by fear or unable to sleep for nights at a time, they can feel almost life-changing. These medications increase the activity of a calming brain chemical called GABA. As that signal becomes stronger, the nervous system slows down, anxious thoughts become quieter, muscles relax, and sleep often arrives much more easily. In the short term, this can be incredibly helpful. But when these medications remain part of daily life for months or even years, the story begins to change in ways many patients never expect. Research published in the British Medical Journal in 2022 followed more than 8,000 older adults over a 6-year period. The results showed that individuals who used benzodiazepines for longer than 3 months faced approximately a 51% greater risk of developing Alzheimer's disease. Longer-acting medications such as diazepam appeared especially concerning because they remain in the body much longer, gradually accumulating in fatty tissues, including the brain itself. Over time, the brain begins adapting to this constant chemical sedation. Learning becomes slower, concentration weakens, and mental flexibility gradually fades. Many patients explain that they no longer feel like themselves. They are not exactly sleepy, yet they move through the day feeling emotionally flat, mentally sluggish, and strangely disconnected from the world around them. Family members often notice the change before the patient does, describing someone who seems present physically but less engaged mentally than before. One of the greatest dangers of benzodiazepines is what happens when someone tries to stop them suddenly. Because the brain has adapted to their presence, abrupt withdrawal can trigger severe anxiety, intense insomnia, shaking, agitation, and in some cases even life-threatening complications such as seizures. That is why these medications should never be discontinued without medical supervision. If you have been taking one regularly for more than a few weeks, the safest approach is a carefully planned taper designed by your physician, allowing the brain time to adjust gradually. The encouraging news is that safer alternatives are available for many people. Medications such as buspirone can help manage anxiety without causing the same level of sedation or cognitive impairment. Equally important, specialized forms of cognitive behavioral therapy for anxiety and insomnia have shown remarkable success, helping people regain healthy sleep and emotional balance without depending on medications that may gradually cloud memory. These approaches require patience, but they often provide lasting improvement without placing the brain under constant chemical pressure. Now we reach number 4, a medication that surprises many people because it is prescribed for several completely different conditions. Its versatility has made it incredibly common, but that same versatility has also allowed its risks to remain hidden for far too long. Amitriptyline, sold under several brand names including Elavil, was originally developed as an antidepressant. Today, however, physicians frequently prescribe it for nerve pain, chronic headaches, migraines, and even insomnia. Because it seems capable of treating so many different problems, many patients never question whether it carries significant long-term consequences. What makes amitriptyline especially concerning is that it is one of the strongest anticholinergic medications still widely used today. It powerfully blocks acetylcholine, the same critical brain chemical responsible for learning, concentration, and memory formation. When this system remains suppressed night after night and year after year, memory loss stops being an occasional side effect and begins to look like an expected outcome. And as you are about to discover, the medication ranked number 3 raises even greater concerns because millions of older adults continue taking it without realizing it affects the very same vulnerable brain pathway. Number 3 is the medication I asked you to remember from the very beginning, because it is prescribed to millions of people for a condition that sounds completely unrelated to memory. Most patients receive it believing they are choosing one of the safest modern treatments available for depression or anxiety. They trust that it will help restore emotional balance, improve daily functioning, and allow them to enjoy life again. Yet hidden beneath those benefits is a characteristic that sets this drug apart from nearly every other medication in its class. The medication is paroxetine, widely known by the brand name Paxil. It belongs to the family of antidepressants called selective serotonin reuptake inhibitors, or SSRIs. Unlike older antidepressants, SSRIs have earned a reputation for being safer and easier to tolerate, which is why they are prescribed so frequently. However, paroxetine is different because it also has strong anticholinergic activity. That means it interferes with acetylcholine, the same neurotransmitter we have already seen repeatedly connected to learning, memory formation, and clear thinking. This single difference may seem minor, but over time it can become extremely important, especially in older adults. While medications such as sertraline and escitalopram primarily affect serotonin, paroxetine places an additional burden on the brain's memory system. Every day the medication blocks acetylcholine, the brain has to work a little harder to perform tasks that once felt effortless. At first the changes may be subtle, perhaps forgetting a word during conversation or taking longer to remember a familiar name. Gradually, however, those small lapses can become more frequent and more noticeable. Research continues to reinforce these concerns. A comprehensive review published in Frontiers in Psychiatry in 2021 compared older adults taking different SSRIs and found that those using paroxetine experienced measurable declines in short-term memory, attention, and word recall within the first year of treatment. Even more concerning, seniors taking paroxetine were approximately 30% more likely to show early signs of cognitive impairment than patients using other antidepressants in the same category. That finding highlights an important reality. Two medications may appear similar on the pharmacy shelf while affecting the brain in very different ways. There is an unfortunate irony here. A medication intended to improve emotional well-being may slowly reduce the mental clarity needed to enjoy that improved mood. Fortunately, this is one of the easiest problems to address, because safer alternatives already exist. In fact, the American Geriatric Society includes paroxetine on the Beers criteria, a respected list identifying medications that should generally be avoided in older adults whenever possible. If paroxetine is part of your daily treatment, it is worth asking your physician whether switching to medications like sertraline or escitalopram could provide the same emotional benefits with much less risk to long-term cognitive health. Supporting healthy levels of B vitamins, particularly B12 and B6, may also complement treatment by helping maintain normal nervous system function, although supplements should always be discussed with your healthcare provider. Now we arrive at number 2. And this category concerns me deeply because many people taking these medications never realized they were being prescribed antipsychotic drugs in the first place. The names include quetiapine, sold as Seroquel, risperidone, commonly known as Risperdal, and olanzapine, marketed as Zyprexa. These medications were originally developed for serious psychiatric conditions such as schizophrenia and bipolar disorder, where they can be highly effective and, in many cases, absolutely necessary. Over the years, however, their use has expanded far beyond those original purposes. Today, they are frequently prescribed off-label to older adults struggling with sleep problems, mild agitation, confusion, or behavioral changes associated with dementia. In hospitals, rehabilitation centers, and nursing homes, these medications are sometimes introduced simply because a patient becomes restless or difficult to manage. While there are situations where their use is justified, they should never become the automatic solution simply because caring for someone has become challenging. The scientific evidence surrounding these medications is impossible to ignore. A major study published in The Lancet Healthy Longevity in 2022 followed more than 25,000 older adults and found that those prescribed antipsychotics for behavioral symptoms experienced a 71% greater likelihood of accelerated cognitive decline within a single year, even among individuals who had no previous diagnosis of dementia before treatment began. Beyond memory loss, these medications have also been associated with increased risks of stroke, sudden cardiac death, excessive sedation, falls, fractures, and repeated hospitalizations. The reason lies in the way these medications affect dopamine, one of the brain's most important chemical messengers. Dopamine helps regulate movement, motivation, planning, attention, and memory. When dopamine activity is significantly reduced, the brain begins operating at a much slower pace. Patients often appear emotionally flat, mentally distant, and less responsive to the people around them. Families frequently describe feeling as though they have lost part of their loved one's personality, even though that person is still physically present. Watching this transformation can be heartbreaking because it often develops gradually, making it difficult to recognize until substantial changes have already occurred. If someone you love has recently been started on one of these medications, do not hesitate to ask an important question. Why is this medication necessary? Is it being used because every other option has failed, or because it offers the quickest solution to a difficult situation? Many behavioral symptoms in older adults improve significantly when hidden medical problems such as pain, infection, dehydration, poor sleep, excessive noise, or unfamiliar surroundings are identified and corrected. Even when medication truly becomes necessary, experts consistently recommend using the smallest effective dose for the shortest possible period. Far too many families are never informed about these risks and naturally assume that worsening memory is simply part of aging, when in reality the medication itself may be contributing to the decline. We have now reached the final stage of this countdown. The medication ranked number 1 is unlike every other entry on this list because it is not a single prescription at all. Instead, it is a hidden danger created when several common medications quietly combine their effects, multiplying the damage in ways that most patients, and even many healthcare providers, never fully recognize. We have reached the final entry on this list, and unlike everything we've discussed so far, this is not a single medication with a warning label attached to it. It is something much quieter, much more common, and often much more dangerous, because it develops slowly over time without anyone noticing. In many cases, no single prescription is responsible for the problem. Instead, the damage comes from the way several medications interact with one another, each adding a little more pressure until the brain can no longer compensate. That is why I consider this the greatest hidden threat to memory in older adults. Number 1 is anticholinergic polypharmacy, also called a high anticholinergic burden. The term may sound technical, but the concept is simple. Polypharmacy means taking multiple medications at the same time, while anticholinergic burden describes the combined effect of several drugs that all reduce the activity of acetylcholine, the same brain chemical we have talked about throughout this video. One medication may have only a modest effect. Add a second, then a third, and the total impact can become far greater than anyone expected. Imagine a very common situation. Someone takes Benadryl at night because it helps them sleep. They also take oxybutynin every morning for bladder control and amitriptyline each evening for chronic nerve pain. Each prescription may have been started for a legitimate reason, and each may have been prescribed by a different healthcare professional. Yet together they place repeated pressure on the same memory pathway inside the brain. Over months and years, that combined burden can become far more significant than any single medication alone. Research has suggested that older adults with the highest cumulative anticholinergic exposure may experience a substantially greater risk of cognitive decline than those with little or no exposure. Perhaps the most concerning part is that many patients never realize they are taking medications with anticholinergic effects at all. They simply know the pills by their brand names and trust that someone has already checked how they interact. Unfortunately, medication lists often grow gradually over the years, making it easy for these combinations to develop unnoticed. When acetylcholine is repeatedly blocked from several different directions, the brain has a harder time forming new memories and maintaining efficient communication between nerve cells. Over time, this can look remarkably similar to age-related cognitive decline. People begin forgetting recent conversations, struggling to stay focused, or losing confidence in tasks they once performed effortlessly. Families naturally assume aging is the explanation, while the possibility of medication-related cognitive effects is never explored. Here is the encouraging news, and it is the reason I wanted to make this video. In some cases, medication-related cognitive problems may improve when the contributing medicines are carefully reviewed and adjusted under the guidance of a qualified healthcare professional. Many people notice clearer thinking, improved attention, and better energy after unnecessary medications are reduced or safer alternatives are introduced. The brain has an incredible ability to recover when harmful influences are identified early, which is why awareness is so important. The next step is not complicated, but it is one of the most valuable conversations an older adult can have. Schedule a complete medication review with your physician or pharmacist. Bring every prescription medication, every over-the-counter product, every sleep aid, every allergy tablet, every vitamin, and every supplement you use regularly. Looking at the entire picture often reveals patterns that cannot be seen when each medication is considered individually. Sometimes only small adjustments are needed to reduce unnecessary risk while still treating the original medical conditions effectively. As you leave today's video, I want to ask you something. Looking at everything we have covered, how many of these medications are currently in your home? Have you ever noticed brain fog, forgetfulness, or difficulty concentrating after starting a new prescription? Share your experience in the comments because your story may encourage someone else to ask an important question at their next medical appointment. Sometimes awareness begins with one conversation, and that conversation can make all the difference. Before you go, remember that medications are only one place where the body leaves clues about your health. There are other warning signs that appear long before serious illness develops, and many people overlook them every single day. One surprising example is your fingernails. Changes in their color, shape, texture, or growth can sometimes point to problems involving the kidneys, blood circulation, nutritional deficiencies, or even the nervous system before other symptoms become obvious. That is exactly what we will explore in the next video. I will walk you through 4 important nail changes that every older adult should know how to recognize, explain what they may mean, and show you when they deserve medical attention. If you found today's discussion helpful, be sure to subscribe and turn on notifications so you do not miss that guide. Thank you for spending these moments with me. Until next time, stay informed, take good care of your health, and I look forward to seeing you again very soon.